It may come as a surprise, but every 40 seconds, someone in the United States have a heart attack. This equates to nearly 800,000 Americans experiencing a heart attack each year. Furthermore, 3 out of every 4 heart attacks are the first occurrence for the individual, while 1 in 5 heart attacks are silent, meaning that the person may not even realize they are having one. You may have seen movies where actors depict heart attacks as a dramatic event, where they grab their chest, roll their eyes, and groan in pain before collapsing to the ground. However, a Hollywood heart attack is not always an accurate representation of a real one. In reality, the pain experienced during a heart attack can be less dramatic, and it may not even be very painful at all. If you suspect you are having a heart attack, it is crucial to call 911 immediately. However, if you do not experience the typical sudden chest pain that is commonly associated with a heart attack, it can be confusing. This is known as a silent heart attack, where the individual is unaware they are having one. Nevertheless, it is still a dangerous and potentially life-threatening event. So what happens when silent heart attack occurs? When there is an insufficient supply of oxygen-rich blood to the entire or a specific part of the heart, it results in a heart attack. Atherosclerotic heart disease is the primary cause of most heart attacks, as it leads to the accumulation of plaque in the coronary arteries. On occasion, a fragment of the plaque can disintegrate and form a blood clot. If the clot enlarges, it can obstruct the passage of blood to the heart. Although uncommon, a severe spasm or constriction of a coronary artery can also lead to a heart attack. This constriction stops blood from reaching the heart. Now, let's discuss about the signs of a silent heart attack. Number 1. Chest pain, pressure, fullness, or discomfort. Heart attacks are often characterized by sudden and intense pain, making them easy to recognize and seek medical assistance. However, this is not always the case. In reality, most heart attacks involve only mild pain or discomfort in the center of the chest. You may also experience pressure, squeezing, or fullness. These symptoms typically begin slowly, and they may subside and reoccur. A study published in the Journal of the American Medical Association found that almost half of people who experienced a silent heart attack reported chest pain or discomfort. This can be problematic since these symptoms may be associated with a less severe condition such as heartburn. Nevertheless, you are the one who knows your body best. If you sense that something is not right, it is essential to seek medical evaluation by a physician or even head to the emergency room. Number 2. Discomfort in other areas of your body. A heart attack doesn't solely impact the heart. Instead, you can sense its effects throughout your entire body. However, this can make detecting a heart attack perplexing. You may encounter discomfort or pain in your arms, back, neck, jaw, and stomach. The manifestation of these symptoms can differ from person to person. For instance, some individuals describe their back pain from a heart attack as if a rope is being wound around them, while others feel an intense pressure on their back. A study published in the journal Circulation found that more than 40% of people who experienced a silent heart attack reported pain or discomfort in these areas. If you are experiencing unexplained pain or discomfort in your jaw, neck, or back, it could be a sign of a silent heart attack. This symptom is more common in women than in men. Number 3. Difficulty breathing and dizziness. If you experience a sensation similar to having completed a marathon after walking up the stairs, it could be an indication that your heart isn't capable of effectively pumping blood throughout your body. Shortness of breath can arise with or without chest pain, and it's a prevalent indication of a silent heart attack. You may also sense dizziness or lightheadedness and could potentially faint. Although this can occur in both men and women, women are more likely to encounter shortness of breath. If you're having difficulty completing tasks that were previously easy, like making the bed, or taking the dog for a walk, it's essential to have it examined to rule out the possibility of a subtle heart attack sign. According to a study published in the journal Circulation, more than 40% of people who experience a silent heart attack report difficulty breathing or shortness of breath. Number 4. Nausea and cold sweats. Symptoms such as waking up in a cold sweat, feeling nauseated, and vomiting can often be attributed to the flu, but they can also be subtle signs of a silent heart attack. Although you may have experienced the flu before, it's important to listen to your gut if you feel like these flu-like symptoms may be indicative of something more serious. Don't brush them off as just feeling under the weather or stress-related, because they could be an indication of a more significant health concern. A study published in the Journal of the American Medical Association found that almost 40% of people who experienced a silent heart attack reported breaking out into a cold sweat. If you are experiencing excessive sweating, it could be a sign of a silent heart attack. This symptom is more common in men than in women. To understand the impact of silent heart attack, research revealed some information. In 2018, a study revealed that individuals who suffered a silent heart attack have similar long-term survival rates as those who had recognized heart attacks. However, survivors of a silent heart attack may be susceptible to other complications such as heart failure and stroke. Another 2018 study reported that individuals who have had a silent heart attack are at a 35% higher risk of heart failure than those without any history of heart attacks. This risk increases further for people under the age of 50. Additionally, a recent 2021 study suggests that individuals who have experienced a silent heart attack may face a greater risk of stroke in their later life. As per the American Heart Association, females may experience silent or unrecognized heart attacks more frequently than males. The risk factors for silent heart attacks are similar to those for recognized heart attacks, and include high cholesterol, hypertension, obesity, smoking, and a family history of heart disease. A doctor may not diagnose a silent heart attack until they check for other conditions. Tests such as electrocardiogram, echocardiogram, stress test, computed tomography to assess coronary arteries, and coronary angiography can assist in the diagnosis of a silent heart attack.